good day, and welcome to the Let's End the Year with Strategies for Less Stress and More Peace conference call. Today's conference is being recorded. At this time, I would like to turn the conference over to Jennifer Gillette. Please go ahead.
Thank you so much, Justin, and thank you everyone for joining us today. I apologize for our delay. But I want to welcome you all to our Lunch and Learn with the LINK. Yes, my name is Jennifer Gillette, and I'm the staff social worker at the National Bone Marrow Transplant LINK. I'd like to welcome everyone to our programs that will focus on strategies for having less stress and more peace this holiday season. A special thank you to our sponsors for today's program, the Leukemia and Lymphoma Society, Insight Corporation, Pharmacyclics and Janssen, Omeros Corporation, and we also thank our esteemed LINK partners. Just so everyone knows how our program is going to go today, we're going to have just a brief introduction to the LINK in case anyone's on the call who's not familiar with what we do. And then I'm going to have our survivor speaker, Diane Raab, speak about what it was like with her recent stem cell transplant, where she came from, where she is now, and what's really helped her cope on that journey. And then we're going to hear from our professional speaker, Dr. Katy LaLone, and then we're going to open the floor for some questions. So for those who may not be familiar with the LINK, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We provide resources, support, and education. Some of the resources we provide to help families navigate their transplant journey are webinars, podcasts, blogs, lunch and learn calls like the one you're on today, which has a variety of topics. We'll cover things like chronic graft versus host disease or disease-specific information. We also have topics of caregiving, coping, treatment options, and survivorship after transplant. We have an active Facebook page with daily inspiration and relevant tips for survivorship. We have our peer support mentor program for patients, caregivers, and donors. We have our second birthdays recognition program where we honor that second birthday that you so well deserve after getting a transplant. And then we have books, referrals, and emotional support from a licensed social worker. So if there's anything you need more support with, please reach out and we're happy to help. Before I begin today's program, I'd also just like to review a couple housekeeping items to maximize the experience of all on the call today. Please be mindful when you have questions to try to keep them concise so we can fit in as many as we can in our hour today. And also please know that the information provided in this program is meant to stimulate conversation with your own healthcare provider and is not meant to replace your individualized medical plan. So now on to the educational part of our program. Our first speaker is Diane Raab. She is a retired clinical social worker and made Sheboygan her permanent home in 2017. She's a recent stem cell transplant recipient and a multiple myeloma survivor. She will tell you where she started on this journey, where she is today, and what has helped her cope with it all. Diane, thanks so much for being here today.
Thank you, Jennifer, and thank you to the LINK for all that you do for all of us out here in the listening audience, and good afternoon to everyone on the call. You gave a pretty good overview of where I am today. I was diagnosed in October of 2020, and actually the COVID pandemic and all the isolation and quarantining that people had to do last year prepared me for what I had to do with my multiple myeloma treatment in terms of wearing a mask and, being careful around people that might be sick. But my journey started actually with back pain up in my thoracic spinal area, and I probably had it for a year or two before I did anything about it. I was attributing it to simple arthritis, and finally it was getting worse, and so I went to see my doctor. She thought it was compression fractures. which it was, but the CAT scan showed lesions on the spine. And from there, the rest of the journey started with additional testing to verify and confirm the diagnosis of multiple myeloma. So we started on chemotherapy regimen, and I was fortunate that my oncologist is about 2 minutes from my home, and I was able to do it outpatient by injection and oral pills, and that was in preparation for the stem cell transplant. So they wanted to give me as much chemo and get rid of those bad guys as much as possible to prepare me for the stem cell transplant, and I was one of the fortunate ones able to use my own stem cells. And the whole process was just fascinating to me in terms of the blood work, the lab work, getting to understand what all the numbers meant, the harvesting of the stem cells, and then the reintroduction of those stem cells in my system. I have been extremely fortunate to have loved ones, friends and family, friends that have become like family throughout this whole process. And I can't tell you how important it is to be comfortable talking about it with your friends and with your family. I learned something about myself through all of this, and that was I was fine saying stem cell transplant and chemo and multiple myeloma, but when new people found out about my diagnosis and approached me and said, "We just found out about your cancer," when they said the word cancer, I found myself kind of flinching. I guess it was easier for me to use a technical term than to actually use the C word, and that was sort of a revelation to me. I'm as Jennifer said, I'm a retired clinical social worker, and you always think you understand yourself, and maybe you don't understand yourself as well as you understand some of your patients, because it's a lot easier to be objective for others rather than yourself. But my the biggest challenge has been some side effects from the chemotherapy and fatigue. And I have learned ways to handle the fatigue, which is basically give into it. Pay attention to your body. It's telling you what it needs. And I'm a fairly active person in the community. I'm on the city council, former president of Rotary. I'm an ambassador with our Chamber of Commerce here in Sheboygan. And I get pretty involved in volunteering for a lot of things. And sometimes you just have to say, okay, Diane, one thing a day, pay attention to your body. And it truly made a difference in my fatigue level. So I'm looking forward to seeing my family at Christmas this year, because last year with COVID and my own situation, we didn't see anybody. Nothing was open. Restaurants weren't open. So we didn't get together. So it's a very joyful time for me this year to see everyone. And some of my relatives are older, and I didn't want to worry them with my diagnosis, so I didn't tell them what I was going through. But I made a decision this Thanksgiving that I was going to let everyone know, because to see me now versus having to be isolated or, without my hair, you really wouldn't know that I was sick. I look healthy. I feel healthy. I behave like a, 12-year-old, maybe not 12. That's kind of adolescent, but I'm sort of like the Energizer Bunny, and they see me now pretty much involved just as much as I used to be. So I felt comfortable telling them about my diagnosis, and they were able to see that I've gone through the past year and came out on the other end feeling pretty good and feeling very fortunate. I'm on maintenance chemo now, and I will be indefinitely, but my view on that is that there are people suffering a lot worse than what I am. So if that's what I have to do, that's what I'll do. And if that keeps me well, then I feel blessed that I have that option. I think that pretty much describes me, where I started and where I am today. The bone pain, the compression fracture is too high in my thoracic spine, so they can't do anything surgically. So, a heating pad becomes my best friend for that, because that doesn't go away. And I'm not really a pain pill person, so, a hot cup of tea and a heating pad, and I'm good to go. So I think that brings us pretty current, Jennifer.
Well, thanks, Diane. We really appreciate you being here and sharing your journey and just what's been helpful. And now I want to see if Dr. LaLone has been able to join the call. Justin, is she with us yet?
Yes, I'm here.
Oh, hello, Dr. LaLone. How are you today?
Wonderful. So great to join you. Thank you, Diane, as well.
Thank you. I'm glad you're here.
Yes, thank you so much for joining us. I definitely want to introduce you. Dr. Katy LaLone is a consultation liaison psychiatrist at Seidman Cancer Center, University Hospitals, and she's an assistant professor of psychiatry, Case Western Reserve University in Cleveland, Ohio. Her research and clinical interests include development of integrated psychiatric care for oncology patients, and she studies neuropsychiatry, palliative care, and is just a wonderful addition, helping the link in so many ways. And we just thank you for being here with us.
Absolutely. It's my pleasure. I did want to make sure you can hear me okay.
Yes, we hear you wonderfully.
Okay, great. So thank you both, Peggy and Jennifer and Diane, for having me today. Thank you, Diane, for sharing your story with us. I think reflections on finding peace during what is often a stressful holiday season can be difficult. Somebody had once said to me at the beginning of the pandemic, if you're not depressed, you're not really paying attention. And I think this still rings true in the holidays. We may have feelings that we're supposed to feel happy, and we have a lot of pressure from people around us, and we may not really know how we feel just yet. As a psychiatrist in a cancer center, I work with many who've been bearing additional burdens with their own health and their own health journey that seems to be further complicated by a lot of the tension going on in our world these days. It's hard not to get demoralized. It's demoralization. I just wanted to define that, is a term for feeling sick and tired of being sick and tired, which is, I'm sure, something most of our transplant recipients can relate to. When will I feel back to normal? When will I feel better? And especially when you're early in your recovery, especially if you spent maybe last year completely isolated, either at home or in the hospital, you really are looking forward to what a normal holiday celebration with your family and friends. Maybe you're longing to kind of feel like that person that you were before all of this cancer or the transplant, to feel connected to the normal things. Maybe you're the chef in your family that, makes all of the food, or the eggnog aficionado, or the aunt who always spoils everyone, or enjoy being a thoughtful friend. And with what's going on with your health care, you haven't been able to do the things you might normally do for others, and that's a place where we find a lot of joy. Being diagnosed with cancer, going through transplant, is a very isolating experience, as we know. And I think even emotionally, when we go through something like this, we're even more in need of love and support from those around us, and can be very sensitive to feeling left out from holiday gatherings, family gatherings. Even sometimes our work goes on without us. We may feel self-conscious about ourselves. Maybe we've gained or lost weight. Maybe we're not ecstatic about taking a family photo with a wig or with the way our hair looks now. And holidays can be hard. We're often reminded of loved ones who won't be there this year. You may miss Grandma's hugs, or Mom's rice pudding, or Grandpa's awkward jokes. And thinking about friends and families who we've lost over the years might feel especially difficult. And nothing in our world feels normal right now with the variants, differing beliefs among family members over vaccines, and certainly gone are the days when we only used to argue about religion and politics. And now, what's going on with your own health care might be something that is not easy to talk about. Many topics are taboo. You may be worried about your being able to get vaccinated because of your transplant and reasons to be in isolation, for other health reasons. And it's sometimes even hard to ask family members about whether they've gotten their vaccines. It's not something everybody's open to talking about. So, we're supposed to be focusing on peace and reducing stress, but I was hoping that some of these feelings resonate with you today, that you would know you're not alone, and not everybody feels pure joy and happiness for the holidays. So I put together 5 holiday pearls of wisdom for finding peace this holiday season, one of which Diane already mentioned. And first is to honor your feelings. It's okay to be sad. It's okay to grieve. Like Diane said, pay attention to your body and what it needs. It's okay to rest when you need to. It's okay to feel numb and not have a lot of emotions. It's okay to be angry or frustrated that you're not able to do what you normally might do, and not always filled with holiday joy. The second pearl is you have a right to your privacy. It's okay if you don't want to share all of your feelings with everyone, online, on social media, or talking with family, and you don't need to feel obligated to update everyone about what's going on with your treatment. I often suggest patients before getting together, with friends or family, coming up with what we call a company line, some sort of statement about how you're feeling, like, I made it through transplant, it's been a rough year, but I'm getting stronger every day. Something that you can say to anyone without maybe having to go into too many details. It's also okay to be honest, and if people start asking you questions. Kids are especially curious sorts of folks who pay attention to lots of things. If their aunt or their nana's hair looks different, they may make a comment, but it's okay to say, I'd rather not talk about it. But thank you for your concerns. The third pearl is to simplify your plans. One of my patients recently told me how much she hates how cancer makes you so unreliable, and talked about how afraid she is of making commitments because what if I wake up that day tired? What if I wake up that day throwing up or in pain and I can't go? I don't want to be somebody who cancels. So my advice would be when making plans, try to keep things simple. God forbid you don't pull out all of your decorations this year, or you could even let someone else cook or order your dinner from Boston Chicken. There are no rules. Maybe you don't feel like hosting all of your relatives. Maybe somebody else could host the party and you could stop by for a brief time if that's what makes you feel more comfortable. That way you can leave when you need to. Try not to put too much pressure on yourself for buying gifts or doing other things that you might normally have done. And it's okay to make contingent plans and tell people, if I feel up to it, I will absolutely be there. Number 4 is I recommend talking with your doctors about any necessary COVID precautions to help you feel safe getting together with families. Many families are still choosing to do virtual meetings, which are not the same, as we know, as hugging someone that we love. If they are getting together, they're keeping groups smaller, masking and distancing, maybe not doing meals in the same room. Or they're asking everyone, even if vaccinated, to test before they get together, just to give everyone a sense of, peace of mind. The last one is to celebrate the small joys. Take some time amidst the hustle and bustle to honor the victories you have had since last year, since your diagnosis, since your transplant. And if you can find a moment, I usually tell patients, when you're not thinking about cancer, we call that winning. Don't be afraid to create some new traditions, maybe driving around to see Christmas lights, using Zoom to have a family sing-along, or a talent show where maybe people record their videos in advance, and try to find moments where you can connect with those you love and have some joy. But above all, be gentle with yourself. So thank you for letting me share my thoughtful pearls of trying to reduce stress and find peace in the holidays, and letting me be a part of this today.
Thank you so much. Those were some excellent pearls, Doctor. I know we are going to be getting into our question portion, but I know there was some that were pre-submitted, and I want to stay on topic of our conversation about the holidays here with those pre-submitted questions, but one of them was some, with the disagreement over vaccines or taking tests or the awkwardness of the discussion, some people were saying, how do I handle if people are treating me like a hypochondriac, or like I'm just too nervous, but I'm uncomfortable going to a gathering and people don't want to wear masks or they're not vaccinated? What would you say to those people? I know you answered that with some, but some people were saying that they're feeling just a lot of hostility from people, and what you recommend.
So this is not an uncommon. Ohio is. We refer to ourselves as a swing state, and I will say that there is not a single person that I interact with that doesn't have friends and family members who couldn't be more different in their political beliefs than themselves, if that makes sense. Where I'm from, it's not a very uniform place. And this comes up a lot. And one of the things is, even among your immediate family members, your journey through the valley of getting your diagnosis and going through treatment is yours alone. And no one else has really gone on that journey with you in the same way that you have, even the people that live in the same house as you. And there are going to be times where you're going to make decisions when you come out of the valley. We talk about the gift is wisdom, that you may make decisions on your life that are different than what other people may have chosen for themselves because they haven't lived your experience. They don't know what it is like to be locked in a hospital for transplant, to have people come in and poke and prod you, and maybe even more dangerous things have happened. You've been in ICUs and hypochondriac to me is a person who's never been ill, worrying about getting ill. A transplant survivor is someone who has survived grave illness and has to make hard choices every day about how to keep themselves safe. Many whom have to redo all of their childhood vaccinations after transplant, and that takes almost 2 years to get all of those in. And so there are other layers of precautions beyond just COVID that patients take that, again, not everybody would understand. I don't know that it's helpful to try to make people understand, even in my own experience with my own family, but I think you have to make the decision that helps you feel comfortable. And thinking about, let's say I went to the event and I got there and they said they would mask, but they didn't. You can leave and say, stand from the door, and I love you, and it's been great to see you all, but we don't feel comfortable staying. I think having kind of an exit strategy or a plan B kind of in place can help. But these are not easy decisions to make. And you can try to be as respectful as you can of everyone else, making the best decisions they know. And some of them are in different circumstances. They don't have the health problems you have. And so it's not fair, but maybe they feel a lot more comfortable doing things. And so I guess I would just, again, taking it back to honoring what you feel. I would encourage you to talk about it with your own doctors and try to make plans again in advance for what you anticipate being your exposures or your risks. But these are hard decisions. And I don't know that anyone has the best answer for everyone. But when you bring a group of people together, there's going to be people that disagree. And sometimes it's easier done just having a smaller gathering is sometimes the best way to go, or not going at all. So.
Thank you very much. I appreciate that. Justin, could you please tell our callers how they can ask their questions of Dr. Katy or Diane?
I'll be happy to. If you would like to signal with questions, please press *1 on your touch-tone telephone. If you're joining us today using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. You'll hear a tone indicating when your line is open. At that point, if you would please state your name and then pose your questions. Once again, please press *1 to signal with questions, *1. And we'll go ahead and take the first question.
Hello?
Caller,
Is there someone?
Caller,
sorry, go ahead.
Voice prompt. I'm sorry, caller, if you heard the voice prompt, your line is open. Please go ahead. Caller, perhaps you have yourself on mute. Please go ahead if you heard the voice prompt and your line is open. And there is no response from that line. But once again, to the audience, if you would like to signal with questions, please press *1 on your touch-tone telephone. Again, that is *1. We'll pause for just a moment, and we'll go ahead and take the next question.
Yes, this is Tamala Jackson calling, and I'm calling because I've had multiple myeloma for 10 years, and right now I've had stem cell transplant, and my biggest problem now is just different things that have come from dealing with the cancer, which is I've had the hips replaced, the one shoulder replaced, but I deal with a lot of something like neuropathy in the fingers where the wound gets too smooth. And I was just wondering if you knew anything about that, and also dealing with kidney stones, and what can I do to help that?
I'm sorry, Pamela, you were breaking up a little bit. Can you try to hold your phone maybe a little differently? I know you said you've had some complications, but wasn't really clear on what the question was at the end.
Yes, like a neuropathy in my fingertips when the room is too chilly. And now I'm dealing with kidney stones, too, just trying to figure out what I can do to help myself with those things, those issues.
Well, Dr. Katy, I know we're mainly talking about the emotional coping today, but Dr. Katy, do you have any thoughts about Pamela's question?
Are you worried about your neuropathy such that you can't, cook or do something with your hands that you would normally doing around the holidays? Is there something that it's interfering with? Or is it more just...
Anytime I'm in a chilly room, my fingers it turns like a gray color, and just get kind of...
I mean, there's no rules against wearing gloves indoors, but that sometimes feels awkward if you're trying to manage food or, other things. I have one patient with neuropathy who heats up sand and puts her hands in warm sand, and she tells me that it's one of the most comforting feelings.
Okay.
It seems a little strange, but hand warmers and things, because it's certainly the weather this time of year with just getting out and traveling, if you live up north like I do, is an extra challenge. Sure, people are extra sensitive to the cold. And I think as far as, managing, specific pain, obviously you'd want to talk with, your doctors about, other ways of doing that. But I think just also realizing that a full day event might be a little too much. You may need to take breaks and rest. You may need to lay down. And sometimes I have patients who call a family member and just kind of say, is it okay that if while we're there I need to rest, I can go lay down in your guest room or something? So that it's kind of, you will feel less anxious knowing that, that you can take a break. And trying to get other younger people from the family involved in stringing the beans or doing the other things that you might not be able to do with your hands, rolling out the pies, or maybe it could be an option for you to be promoted to management. And you can supervise and still be involved in the cooking, but use somebody else's hands to help you do the things that you might normally do.
Thank you.
Thank you. Do we have any more callers?
Not at this time, but once again, if you would like to signal with questions, please press star 1 on your touch-tone telephone. Again, that is star 1 at this time if you would like to signal with questions. We'll go ahead and take the next question.
Since it seems like I'm the only person that's calling. This is Tamala Jackson again. But another question I have is about my nephew. He has myeloma also. And with his medication, he only has 2 good days out of the week. And what can he do? Because he's a younger person, 36 years old.
Well,
I know that.
Go ahead.
I was going to say, for patients that are certainly still in treatment, that we talk a lot about good days and bad days. And, the weeks they get their chemo or their treatment, we plan to cocoon is what we call it. You don't plan a lot of events. Go to a doctor's appointment. Those are good things to do on your bad days. And you try to schedule the enjoyable things in life for the good days. And so if the good days for him don't happen to follow on Christmas Eve or Christmas Day, maybe you guys plan a family event on one of his good days. There are no laws against celebrating, whether, again, if it's Christmas or other holidays you celebrate, on the day itself. And so trying to accommodate to somebody's schedule is a very thoughtful thing that you, having your own experience with this, are probably more aware of than maybe other family members. Unfortunately, days off work and jobs don't always help us to find another day that's mutually agreeable for everyone else in the family. But trying to cater things to a day that you don't have treatment or might be feeling better seems like a reasonable way to try to be thoughtful of everyone.
I like that thought. I like that. Thank you.
Great tip. If anyone else wants to ask a question, you can, but I also want to hear Diane's thoughts on that. Diane, I'm sure you've had some really rough days this year. How have you managed in trying to make the best of those good moments and taking care of yourself during the not-so-good days?
Well, I think that what Dr. Katy said is so true, that sometimes we get sort of, we have to think outside the box. If you don't have to celebrate on the designated day, the 25th of December or Thanksgiving, if that's not a good day, then you need to take care of yourself and do it on another day when you're feeling really good, and giving yourself permission to not feel you have to do it on that day, or you're going to let somebody down, or when you spoke earlier, Dr. Katy, or I think the question that was sent in earlier about feeling like a hypochondriac, people really do not understand that there are days when you are genuinely just sick, and despite their not understanding, you have to recognize that you just feel like crap. And it's okay to give in to that and give yourself permission to to stay in bed or stay in your chair or just sit on the deck in the sunshine and not talk to anybody. And I tend to be a talker, and I found that there were days I just didn't want to take a call. And fortunately, with our phones these days, we have caller ID, and you can hit decline when you're not feeling like it, and not feel guilty about it, because guilt only implies you did something wrong, and taking care of yourself is not wrong. And so I think that's the main thing is think outside the box, celebrate on a different day, celebrate on a good day, and when it's a bad day, it'll pass, and it will. Even though it feels like it's going to be forever, the good days certainly can make up for that. So I think the main thing is giving yourself permission to do things differently.
Thanks, Diane. Do we have any other questions on the line, Justin?
We do not, but I would like to remind our audience again, please press star 1 if you would like to signal with questions at this time. Again, that is star 1 on your touch-tone telephone. Oh, we just got an additional question come in. We'll go ahead and go to that caller.
This is Juanita McReynolds. I don't have a question, but I just wanted to say, especially because the other lady thinks she's the only one out here listening, we are listening. And I wanted to say, Diane, I enjoy hearing about her experience, and also was reminded of my own experience. I didn't have multiple myeloma. I had leukemia, but it was hard for me to say anything other than a blood disorder for a while. And it took a while for me to get out of denial and say, you don't have a blood disorder, you have cancer. You better act like you have cancer. And so I'm laughing. It's not funny, but it was like, for me, it was like I had to instruct myself on what my condition was before I could help anyone else understand it. So it took a while, but I could identify with that. And with the doctor, I just wanted to say I'm a long-term survivor, but I've had some other coping issues with stress and everything. And so even though I've survived the cancer, I applied everything that she said to dealing with non-cancer related stress from the holiday itself. So I just appreciate it.
Oh, thank you, Anita. Can you tell our lovely audience how many years it's been for you?
Yes, ma'am. In fact, in January 2022, I will celebrate 20 years post-bone marrow transplant from my leukemia.
Woo! If anybody needs a gift of hope, that is that.
Congratulations. Wow.
So much. And I'm glad to share, because somebody needs to know you can survive cancer. And you can not only survive it, you can thrive. And I think I'm thriving. Sometimes I'm not so sure, but I do know I am a thriver.
Indeed you are, and I think anyone who knows you would say the same thing, Juanita.
Well, thank you so
Thanks
much.
so much for calling in. Justin, do we have any other calls?
We do not, but once again, that is star 1 if you would like to signal. Again, that is star 1.
While we're waiting to see if anyone joins the line, I'm going to share some tips we've gotten from people on dealing with the holidays in the past, and perhaps one of these, many of them have already been said or maybe said in a different way, but I just want to make sure everyone gets as much nuggets as they can, because this is, just like Dr. Katy was saying, a particularly extra stressful Christmas holiday season with COVID and everything. So one of the tips we've received is pick 3 to 5 goals for yourself to prioritize what's most important to you over the holiday. Maybe it's watching people open presents or making that pie, but focus on what are those really highlighted special moments to you, or like Pamela talking about, cooking, and Dr. Katy saying how she could be in management. That's a wonderful way to pass on those gifts and legacy. So looking for ways to keep those going, but maybe in a more flexible way. Don't take unnecessary risks and listen to your body, just like Diane said. And then also you can consider even bringing your own food if you do go to an event. And then also remembering mindset, that it's not just about this holiday season, whatever you celebrate, it's about investing in being here for more holidays by following your treatment regimen. Make sure you keep up with those medications, make sure you keep up with your treatment, and let others help you along the way. And you can even just try to find ways to not overdo it. Again, simplify where you can, and also communicate where you can, like especially with really close family, and if they're wanting you to feel comfortable, like is there smells that make you more nauseous? Is there foods that you can't have? Or, of course, the communicating what you need to be safe, or even just doing the Zooms or the FaceTimes or all those creative things Dr. Katy was talking about. And then be realistic with yourself. Again, it's okay to reschedule things or pick different days or do it in a different way. And then enjoy and try to pause, to let moments soak in. And let yourself get support during this. If you find that you're having a really hard time this month, whether it be your own support system, your village, or reaching out for professional help, there's a lot of people this time of year that really need that. So don't be afraid to get that for yourself. Put things in perspective. The best gift you can give, again, is to be alive for following holidays. So really invest in your health as the best gift for you. If you end up being in the hospital this holiday season, ask if you're allowed to decorate. Maybe make the room more homey. Do what you can. Figure out what your motivation is. As we are going through these hard times, what is your meaning for fighting so hard? And really thinking about that as we're trying to go the distance. Advocate for yourself when needed, and work on the mindset. The sooner I get through this, the sooner I get out. Everyone I've talked to seems to have their own version of a motto, but when times get tough, like I know Diane's friends with one of our dear volunteers and past board member, John, who his wife and he used to say, when times were tough, put one foot in front of the other, just like that little Christmas song. So continue to just feed what makes you brave, but allow yourself flexibility and rest and listening to your body. But on that note, Justin, is there anyone else on the line?
There is. We'll go to that caller.
Great, thank you.
Hi. I was just wondering if there's any other blood cancer patients out there that have not been vaccinated and are feeling, stress and pressure from, other people saying, you should be vaccinated and all that, and, and how to deal with that.
There certainly is. I'm going to let Dr. Katy answer that one.
So I have lots of patients who are post-transplant who do not feel comfortable getting the COVID vaccine. Many of them are still getting their, regular childhood vaccines. And again, based on your immune system, your doctors may not be recommending it. But I think we also don't even know for sure that people that are vaccinated after transplant have the same level of protection that somebody who's otherwise healthy would have after vaccination. And I think
right.
the reality is
unfortunately, you cut out a lot.
Okay, sorry. And what I was going to say is that I have lots of patients who do not feel comfortable getting the COVID vaccine, who are post-transplant. I think taking a level of precaution right now requires us having open conversations with the people that we're going to spend our time with and trying to be as safe as possible. So if we're in my own family, we're deciding that everyone gets tested before we get together for a big family thing for COVID. It's really bad in Ohio right now. And we had hoped that this would be more of a normal holiday compared to last year, but we're not yet back to normal. And I think that's honestly a feeling people feel a lot with coming through transplant is we're not back to normal.
Right. I have not had a transplant. I did not realize that this Lunch and Learn was for transplant patients. I've only been treated with Rituxan, and we'll probably be getting another round of Rituxan, within the next month or so. But, the doctors are saying get it, but it might not help you. But I just don't feel comfortable. If it's not going to give me the protection, I'm one of those that just has a reaction to everything under the sun. And so, I'm just kind of like, I'd rather just live and be careful and try to keep myself healthy than to get the vaccine.
And like I said, I had patients who are fully vaccinated get very sick with COVID because they're on treatment for leukemia or lymphoma. And just being vaccinated does not guarantee anyone that you can throw all precaution to the wind.
Mm-hmm.
Yeah.
And be, reckless is just the word that I use. So we should all still be using precautions regardless of vaccination. It is a tool, but it's not a tool that works for everyone, especially the immunocompromised. And it's still a group of patients who are especially vulnerable. And that doesn't mean that people that are otherwise healthy, I wouldn't encourage them getting vaccinated to try to, reduce their risks to help their family members who can't get vaccinated, perhaps. But, people end up, as adults, as you know, making their own decisions. And we want to try to be respectful of everyone's preferences.
Right. And is it like an automatic, person with a blood malignancy will get, gravely ill, if not die from this? I mean, is that like a definite thing?
There is an increased risk of death when you have a compromised immune system. And that's even if you're vaccinated. So I think that you have to carry an extra level of precaution, which is why this is such an isolating disease. Normally it is already. COVID is a whole nother layer of isolation, I think, on all of us, where the average American has learned a little bit what it's like for a transplant patient to be told you can't have certain foods and you're not allowed to leave, your house and you have to wear masks all the time. And it is not an easy way to live. And there's a part of, I think, all of us that would prefer that life would be like it was 2 years ago or before all of this. And
of course.
So I think you make the best decisions you can, and I would just encourage being honest with the people in your immediate circle, your immediate family, about what everyone feels safest doing so that you can get together if you're feeling up to it.
Mm-hmm.
And right now,
I'm feeling pressure from the doctors.
Well, they're allowed to be opinionated, I guess. They have training. But in my business, I'm not very successful at convincing anyone to do anything they don't want to do. So usually I'll share my thoughts and then we agree, I'll support the patients in their decisions. And I think that's usually where they're at, but I
also want to just add here, I heard something interesting recently As I have been a caregiver to someone, and this is Jennifer, I'm the social worker at the LINK. I heard a doctor say recently, the fact is, I'm going to tell you what I think is best, but ultimately you're the one living with the consequences, good or bad, of any decision that's made. So this really is up to you. And right. I know right now this is a really hard time because there's a lot that has had to happen in a very fast way. But at the same time, too, based on the research they have, you know, many doctors are really believing that this is the way that we can try to slow things down and change things. But ultimately, if you're not comfortable, the decisions you make are the ones that you live with. And so no one can tell you what you have to do. You get to make that decision, whether it be cancer treatment, whether it be vaccines. They just bring you the research and they bring you their expertise, but it is in your lap.
Right.
And sometimes that feels very overwhelming as a patient. Thank you, Jennifer, for sharing that. Because I think even making other decisions,
make sure you're doing the right thing.
Because most of the time, most of your family members or friends are not going to have an opinion about which chemo you choose, but everyone seems to have an opinion about vaccines. And I think,
that's for sure.
I think there's a lot of responsibility on patients right now to sift through what their friends and family's opinions are, political opinions, you know, we're getting from, you know, different leaders, and they could not be more different, the things that we're told these days. And then looking at what, you know, our doctors are telling us. And again, your relationship with your team and your physicians, I would hope, is built on trust and mutual respect. But I often, if I have a patient who's not agreeing with with their team, recommend they consider second opinions if they don't feel like they're getting treated with respect. And so again, this is much more complicated, and people that live, you know, in areas where you don't have access to lots of different hospitals, like we might, you know, where I live, you know, that's not always an option. But most people will respect your decisions and try to work with you around that. And try to not let other people in your world make judgments about your medical care, because that's ultimately your decision.
Okay, thank you very much. I appreciate it.
Thank you. We are coming to the close of our hour, and so I would just like to thank everyone for being a part of this call, and I certainly want to thank Dr. Katy and Diane for making the time to be here with us today, and I hope everyone got a little nugget to try to help make their holidays be a little more peaceful. But just remember, it's okay to be flexible, and it's okay for you to make boundaries and give yourself rest. Stay tuned, just so you know, we will be having more wonderful programs set up for you starting in the new year. Our first Lunch and Learn will be on nutrition, so you'll be receiving more information about that. But again, for now, I thank our LINK partners, our sponsors, and on behalf of the National Bone Marrow Transplant Link, I wish you all a wonderful, healthy, peaceful holiday season. Have a great day.